So my name is Professor Sharon Peacock. I'm Professor of Public Health and Microbiology at the University of Cambridge, as well as being Director of the COVID-19 Genomics UK Consortium. Before the pandemic, I spent a decade using pathogen sequencing to better understand the transmission of pathogens and outbreak investigation, together with antibiotic resistance. COG-UK first began in March 2020, when there were a very low number of cases in the United Kingdom and worldwide. We thought it important to set it up because viruses, like other pathogens, can mutate, and we were concerned that we needed to track those mutations in case there were variants that arose with different biological characteristics, such as increased transmissibility or evading the immune system. Focusing on key lessons during the pandemic, I'd just like to mention three. The first is the importance of partnerships. So partnerships were really important. We couldn't do this alone. We needed to bring together academics, the large sequencing facility at the Wellcome Sanger Institute, together with the 4 public health agencies of the United Kingdom and the NHS where tests were being done. That was really key for us to be able to operate. The second lesson learned is a lesson that we all really know inherently, and that is the importance of people. So people have been fantastic. They've worked together, often on a voluntary basis, and they're what's made COG-UK really work. The third is data linkage. We need to be able to link the genome data with the patient from which the sample has come. That's so important, but not as easy as it sounds, and we got better at that over time. So at the initial setup of COG-UK, the key was pace over perfection. We just needed to get some sequence data generated. But over time, we improved standardization of sequencing together with the turnaround time. So we reduced that quite significantly to get that information to public health agencies. And in addition to that, we reduced the cost of sequencing each sample. So the existing capabilities that we used to build COG-UK included a decade of investment and research on pathogen genomics across the UK. We had the people, the expertise, and the equipment across the UK in academic laboratories. In addition to that, there had been investment in CLIME, which is a cloud infrastructure for microbial bioinformatic analysis and data storage, and that helped us greatly to get started with storing genomes and analysing them rapidly. A really important consideration when we first set up COG-UK was to have an open access data sharing policy. So any genomes we generated were immediately released to everybody worldwide so that they could also have access to them. So COG-UK was made up of sequencing hubs that were of quite a different size. So the Wellcome Sanger Institute had very high throughput, whereas some of our more regional labs, they actually had quite low throughput. So my feeling is that a lab can contribute genome sequences that have impact no matter what size it starts out as. When we first set up COG-UK, we did face a small amount of scepticism. There were some scientists who thought that the virus would not mutate at such a pace that it would cause us any problems in terms of becoming more transmissible or dodging our immune system anytime soon. And so we did face comments on Twitter saying that we'd be sequencing the virus over and over again. However, I think there was more support than scepticism, support from government and colleagues for us just to get going. One of the main achievements of COG-UK was to provide genome sequence data to public health agencies so they can better control the pandemic, in particular when the variants emerged that were more transmissible or could dodge our immune system. Another achievement was depositing the data that we generated, now more than 1.5 million genomes, into open access databases for use by others. But perhaps a lasting benefit will be that the way we've used sequencing means that pathogen sequencing will always be seen as a key and critical part of future pandemic responses. The pandemic has led to global collaborations on genome sequencing of the SARS-CoV-2 virus. But sadly, many countries still lack access to sequencing capabilities, which means that they do not know if there's variants of concern emerging in their country, and that's really important. So my hope for the future is that we have both equity of vaccine access and equity of access to genome sequencing worldwide. Pathogen sequencing can't be linked to national wealth because variants can arise anywhere in the world. So we need to understand where variants are arising because with global travel, these can travel very quickly. Variants of concern in one nation is important for that nation, but also for the rest of the world. Some of the shared challenges for genome sequencing worldwide include equitable access to funding, equipment and training so that everyone is able to do sequencing. Having achieved sequencing, the next challenge is to have equitable data access and sharing so that everyone can benefit from that information and not just a few. There's going to be future applications of that technology that can be used worldwide. That includes other viruses and bacteria and their transmission around the world, but most importantly, the threat of the next pandemic. So as a woman scientist and leader, I'm really passionate about the role of women in science. In COG-UK, we've set up Women in COG, which highlights the role of women in the pandemic response in the UK and elsewhere. And I'm also really committed to the importance of social mobility through education. And so we do what we can to support that because we need the brightest minds, no matter where people come from or where they live right now. Thinking about how the pandemic has been for me as a leader, my answer would be similar to many other people. This has been the hardest time of my life in the last 24 months. That's true for many people. It's also been the most rewarding time of my life because I've been able to give back to the people around me, my friends, my family, the people in the community. And that's been incredibly rewarding. In COG-UK, we can't fight the pandemic on our own and do sequencing for the world. But we are committed to helping, and we're doing this through our training programme, which is going to be openly accessible to anybody who wishes to access it. Sequencing of SARS-CoV-2 can give us incredible information about how the virus is evolving, which allows us to try and keep one step ahead of it. However, sequencing can also lead to problems in that countries that do sequencing can also find variants of concern, which can lead to unnecessary blame for that country. We need to ensure that countries that are doing sequencing are praised for doing that because they're providing information that can be used worldwide.